Let me take you back to January of this year. And in January of this year, a new study had come out, and it was looking at alcohol consumption and what levels of alcohol consumption were quote-unquote safe. And I may be exaggerating here, but the study basically said, don't drink any alcohol, nothing is safe, 0 drinks, pretty please. And it was recommending that we significantly cut the amount of alcohol that we drink. That study got a lot of attention. We talked about it on this show. We spoke to the authors of the study, and we got your reaction. I remember it at the time, right? Because they were really telling Canadians, stop drinking as anywhere near what you're drinking right now. So let's fast forward, because now we're in July. This week, Le Devoir has published a couple of pieces that take a look at this study. And there are some allegations about the people behind the study, links to pro-abstinence groups when it comes to alcohol. And it was in January that Dr. Peter Butt, associate professor in the College of Medicine at the University of Saskatchewan, a co-chair of the Canadian Centre for Substance Use and Addiction, joined us on this show. And in light of the stories that have come out this week on this study, we asked him to come back on the show, and he's said yeah. So, Dr. Butt, welcome back to the program.
Well, thank you very much, Elias. And really, I must start off by correcting you. We did
go ahead.
not tell Canadians to stop drinking.
No, I know, and I was. It was a tongue-in-cheek kind of joke, but because
thank you very much for being tongue-in-cheek.
Because we had the discussion at the time, right? And I remember our discussion. You know, you didn't come on here, and it wasn't that, like, because we even touched upon, like, hey, there's happiness that's derived from having that glass of wine at night, and we even touched on that, right? So, you know, in that spirit, that's how I want to have this discussion here.
Absolutely. It's a little bit early in the morning for me here in Saskatchewan to be sharing that convivial drink. But,
yeah, of course.
You know, frankly, the report's recommendations were very simple, that Canadians should consider reducing their alcohol consumption. We didn't set a goal for that. Drinking more than 2 standard drinks per occasion increases the risk of acute harms, and if pregnant or trying to get pregnant or breastfeeding, it's better not to drink alcohol at all. Really not too dramatic or disturbing or alarming, unless, I guess, you're related to the industry.
Okay, so then let's get to that, right? So the 2 headlines this week from Le Devoir, one talks about the links of your group to of your study to a group that is in favor of abstinence when it comes to alcohol, and then this morning another headline that says, "Was the Canadian alcohol study pseudoscience?" Right? How does that feel when you read these headlines? How does that feel?
Well, really, this is becoming pretty standard for the industry with regards to Movivendi, which has its roots as an alcohol public health interested organization. It has its roots in the abstinence movement. It's actually a sad piece of journalism, because the writer admits in the article that the 3 out of 23 panel members were not members of Movivendi, had no formal ties to the organization. But as internationally recognized alcohol experts, they were simply invited to attend and present at a conference that was organized by this organization. So that was the extent of the ties. They were neither enduring nor sufficient to cause a significant conflict of interest. So we certainly stand by our conflict of interest reporting and adjudication. It was overseen by the Public Health Agency of Canada, as well as our methodology. So this is all transparently posted on the CCS website. So I think what's more noteworthy here is that this represents the alcohol industry scrambling to discredit the inconvenient truth that its product causes cancer, heart disease, and other health harms on the heels of the announcement of a class action lawsuit in Quebec. I think we're going to be seeing more of this misinformation, more of these industry agents being paraded through the media trying to discredit the evidence.
Do you think that the alcohol industry is seeing, the movement, things like Dry January, and like it's gone from Dry January? I know a lot of people that used to drink, and they never had a problem with alcohol per se, but they've just said, no, I don't want to drink alcohol anymore. I see that more and more. Do you think that's what's behind this? Like the alcohol industry is seeing sales suffer from a whole segment of the population that just says, that's it, no more?
I think there has been a decline in sales. That's been tracked. Some of that might be attributed to the use of cannabis. But I think people are stopping. They're pausing once they're given the evidence, and they have the right to know. We're not telling people what to do. We're simply telling them, here's the evidence. Less is better. Situate yourself with regards to your personal risk in alcohol and make your own decision. And I think people are being responsible in that, in choosing to decrease the amount that they drink. And, of course, there are health benefits related to that: better sleep, less cost, improved heart health, decreased risk of cancer and liver disease. So I think people are being more reasonable in their approach and not ignoring the truth.
We're with Dr. Peter Butt, co-chair of the Canadian Centre for Substance Abuse and Addiction. Doctor, do you think that perhaps in January, because I know you didn't say no alcohol, but I think was the recommendation 2 drinks a week? And what was, because I think the recommendation at the time was such a shocker to so many people. You know, and they say everything there's an equal and opposite reaction, right?
Right.
Like, do you think that's part of why we've ended up here in July with these types of headlines? Because for a lot of people, the recommendations were too severe.
Yes. Well, those weren't recommendations. In terms of presenting the evidence with regards to alcohol and health-related harms, we had a wonderful partnership with Unfounded, who presented it very clearly in a graph. And in fact, that presentation won a Clearmark Plain Language Communication Award, an international award, for that clear presentation that as you drink more, risk of harms increase. And what we showed was that the absolute risk level, which was at 1 in 1,000, which is comparable to dying from drowning in Canada, 1 in 1,000 came out at 2 standard drinks per week. And then 10 times higher than that, at a risk level of 1 in 100, we came out at a level of 6 standard drinks per week. And that 6 standard drinks per week at 1 in 100 risk level is comparable to what the Australians found when they did their research over a period of 5 years. They came out with a number of 7 standard drinks per week. Canadian standard drinks, you have to modify their definition with ours of what a standard drink is. Mm-hmm. But that's they called that low risk, but that was at a 1 in 100 level, and that level has been used historically because of our relationship with alcohol, because of the fun factor, because of the social, economic, and cultural attachment we have to alcohol, not for health reasons. So our approach was to be much more transparent and use international standards for risk. So 1 in 1,000 is actually the acceptable level for voluntary risk exposure. And we said, here it is, folks. This is actually what the risks are. Situate yourself. I would personally recommend people get down to that moderate zone, which is 6 or less standard drinks per week. If they're at significant risk by family history or have actually an alcohol-associated condition, they should reduce to 2 standard drinks per week or perhaps even lower.
Dr. Butt, we have to leave it there, but I really do appreciate you coming back on to talk about your work and defending the work, especially in light of this week's headlines. Thanks so much for your time.
Thank you.
That is Dr. Peter Butt, Associate Professor in the College of Medicine at the University of Saskatchewan.